Are you planning for pregnancy? Are you in that stage where you want to fall pregnant and have a baby? Then this is something that you should watch. Simple steps to follow so you can prepare yourself for what's to come and have better outcomes in terms of yours and your baby's health. I'm Dr. Kavipriya Soma, a GP with special interest in women's health. So here are a few tips that you can follow to get pregnant and get better outcomes for both you and your baby. First things first, I'm sure if you watched my previous videos, I always emphasize on eating healthy and exercising. And I'm going to re-emphasize the same 2 points again. I'm sure you're going to get bored, but that's really, really important. Eating healthy, in simple terms, it means eating fresh fruits, vegetables, and whole meal foods. Please cater to your own dietary requirements, but this is the gross advice that I would give you. If you have specific dietary requirements, seek appropriate professional help from nutritionist or dietitian. But in general, I would recommend eating more fruits, more vegetables, and whole meal foods. Now, the second thing, exercise. I'm again sure that we have mentioned about this in our previous videos, but here it comes again. What is exercise? Minimum 150 minutes of exercise per week is what is recommended by the guidelines. What you do it, I would say mixture of cardio and muscle strength training, but feel free to choose what you would do consistently. You can start slow, small steps, 10 minutes a day, but be consistent. There will be days that you're not going to have the mood to do it. There will be days it's going to rain, it's going to shine. Everything will affect your performance of exercise, but please, consistency is the important thing. Now, what are the other simple things that you can do? Stopping smoking if you are one. Very, very important. This applies to both partners, because as much as a female health is important, the men's health is also important here. So stopping smoking. Again, there are options like quitline available, or seek help from your health professionals. There are many non-medical therapies and medical therapies available to stop smoking. And sometimes it can be used in the part of pregnancy as well, because smoking can be more dangerous than the medical therapies that are available to you. So please be aware. Stopping alcohol intake, also for both partners. So as much as possible, zero alcohol is what we recommend, but if you can cut down as much as possible and make it zero prior to falling pregnant, it would be optimal. So the other things that you can do is to go and have your bloods taken to look at your general health. So your iron, your vitamin levels, and also making sure that you are actually immune to rubella and chickenpox or varicella. If you are not, then there is an opportunity for us to administer these vaccines prior to you falling pregnant, which would help with transferring your or maternal antibodies to baby for their own protection in the first 6 months of life. The other things that you need to be checked for is sexually transmitted infections as well. And again, this applies to both partners. So these are all some of the bloods that you can get. Now, apart from this, supplements intake, important one is folic acid. So minimum 400 micrograms of folic acid is recommended per day during pregnancy to prevent neural tube defects. So at least 3 months prior to conception and ongoing intake for the first 3 months during pregnancy. Very, very important. So just because something has happened and say, for example, you've fallen pregnant, you've had a miscarriage, but you still are planning for pregnancy, please don't stop taking the folic acid. Continue to take it. So that's really, really important that it is taken to prevent neural tube defects. Now, the other things that you need to look at is your day-to-day working environment. So where you are, what you're exposed to, what you do is also important. So take care of that. What else? Stress. Yes, everybody is stressed. Falling pregnant is stressful, being pregnant is stressful, having a baby is stressful. So stress management becomes really, really, really important. I can't emphasize enough to say how important it is to manage stress. Again, as mentioned in all my previous videos, how you manage stress completely depends on you, and seek help professionally if that is something that you require. Otherwise, incorporate stress management into your day-to-day life with simple things, breathing exercises, yoga, meditation. Yes, thoughts will come to you when you're sitting to meditate, but that takes time to practice. So if you don't have time now, how are you going to have time to do this when you have a baby? So think about that. It's really, really important that you learn to manage stress. The other things that you need to know is your family history. So a family history of genetics, diseases or syndromes become important, and twins, yes, it's also important. So it's good to gather that information before you go see your general practitioner or your gynecologist while you're planning for pregnancy. Your own personal history or medical history of chronic conditions, diabetes, high blood pressure, high cholesterol, all of them need to be managed, including thyroid issues. So they all need to be optimized before you plan for pregnancy. So definitely make sure that all these, like your blood sugar levels, your cholesterol levels, your thyroid function is all optimal prior to the planning of pregnancy. Now, in Australia, we have genetic screening that is covered by Medicare that covers Fragile X syndrome, cystic fibrosis, and musculoskeletal dystrophy. That is covered by Medicare. It can be done simultaneously for both partners or sequentially, starting with the female partner and, if needed, the male partner. So please take advantage of this and go talk to your healthcare professional. There is also genetic testing available during pregnancy. So we're talking about genetic carrier screening that is available pre-pregnancy or prior to your planning for pregnancy. It can be done in advance. So please make sure you discuss about this with your healthcare provider. If you would like more information or if you would like to visit our website, please visit www.athenawomensclinic.com.au, and you can also tell us if there's any other topics that you'd like to discuss.